Welcome to Snip and Sip, the podcast where we cut through the noise about plastic surgery while sipping our drink of the day. I'm your host, Dr. Scottsdale, from my real name, Dr. Mata. We're gonna talk about funny, we're gonna talk about trends, we're gonna spill the tea and all the secrets. All right, guys, welcome back to episode number
14.
Big 1-4, almost as old as Alondra, right?
Mm-hmm. Just 2 years younger.
Yeah, you wish. Anyways, so who am I joined by today? To my left is?
The social media coordinator, your family member, Lonnie or Alondra. Either
Lonnie.
one.
There's no Lonnie, okay?
Yes, there is. It's 14 times now.
Spell Alondra.
L-O-N-I. We've talked about this.
Alondra.
L-O-N-I. Anyway, moving swiftly
she doesn't even know how to spell her own name, okay? And by my lovely right,
Jeanette, our nurse Scottsdale.
Yes, my lovely wife. And so what's our drink of the day, guys?
Today is going to be a fun little twist on tequila pineapple. So we have a tajin brim with the fun little straw.
All right.
Okay.
Well, cheers, guys.
Salud.
To our 14.
14 episodes. It's kind of crazy. It's been a long time.
Mm-hmm. Well, we gotta get some B-roll.
Wow, that takes a really long time for that straw.
Yeah.
I feel like I'm sucking really hard.
Yeah?
And I'm not used to that, so
Oi, so now we know what you do in your free time.
Don't suck. That's what I don't do. So you heard it here first, right, guys?
That would be, we would have issues.
Yeah. I wouldn't be married to this one.
Well, I don't know what your anatomy is. I don't judge.
I'd be a dude. But anyway.
Yeah,
All right. What's the topic of the day?
What's the topic of the day, Alondra?
Today's topic is
You have to look?
surgical reversals. I don't know if you guys remember, but I have a very short memory span. But yes.
Memory or attention?
No, memory. Not attention span, memory span. I'm like Dory.
Okay.
But yes, reversals on plastic surgery.
Okay. So what do you think about reversing plastic surgery, Nurse Scottsdale, since you've partaken in the surgical endeavors?
I don't think I've ever had a reversal of any kind of surgery. I had addition to my surgery, but not a reversal. I think everything is doable, but how do they look afterwards if you're trying to reverse something? That's my question.
Well, as the surgeon, and probably the only surgeon here, reversal is probably one of the hardest things we do. Because you're asking for something to be undone that was done. And it's like, hey, I built a house. Hey, you know what? I don't like it. Take it down. But make me the house that used to be there. How do you do that?
Yeah, when you've already changed the anatomy.
It's a hard ask. Is it doable? Yes, to a certain degree. But you have to understand, in order to undo something, you kind of have to destroy it. It means you have to take it apart, put it into its parts and pieces, and see what you can use and not use, and then get a result that someone's going to be happy with.
So probably a lot of scars, I'm assuming.
Well, I would say it's not necessarily a lot of scars. It just has to be well-intentioned scars. And what I mean by that is, yes, you can reverse a lot of things, but it's going to take scarring. And are you willing to accept the scars, even though they might be long, fine lines, for a reversal? You have
Well, why do you
implants?
think people want to get it reversed in the first place? Like, what are some reasons?
Well, let's say I took your implants out or your implants out. Why would you want them out?
I wouldn't, first of all. But
I think if
I
you're
don't
having
know.
a lot of issues with
What are
the
issues?
implants, I don't know, people are opting also to go smaller.
Okay, so size.
And how about breast implant illness, which has been a big topic as well.
I think, when we get into the topic of BII, right? Breast implant illness. One, as plastic surgeons, we're trying to change the misinformation that's out there. So we don't call it breast implant illness. We call it systemic symptoms of breast implants. Because they're systemic symptoms, people report symptoms all over their body associated with breast implants.
just pause.
So the thing that you have to understand when we're talking about breast implants is that all medical devices have issues. It's not just breast implants. But now with the advent of social media in society, the people that complain or yell the loudest are the people that get hurt the most, right? Wouldn't you sit here and say that? That the people that are unhappy with anything, this restaurant sucks, and they start screaming it, versus somebody says, oh my God, I love this restaurant. Will people look and pay attention to them? Probably not. But whoever complains the most gets the most. Now, at a restaurant, if somebody complains, what are you going to do?
They're going to put the attention on them and get it fixed and all that.
Correct. And if somebody's like, oh my God, I love your restaurant, you're like, cool, thanks. Now get out so we can get the next person in. Tell me I'm wrong.
Yeah, basically.
Right?
Yeah. We're really quick to write reviews on things that we don't like versus things that we like.
So what would you say people are saying about implant illness, though? Like, what are some...
Symptoms.
Yeah. Because
Well,
I know I've heard some things, but it's like, it's a bunch of different things that I've heard. So I don't know.
And it's true. And this is the hard part, okay? When you're talking about systemic symptoms of breast implants, it's systemic symptoms. I'm tired. Oh my gosh, I don't remember things. I've gained weight. I've lost weight. My joints hurt. I'm always tired.
Maybe
I have a rash. If
But-
you can't figure out what it is, those kind of symptoms get associated to breast implants.
But can't that just be anything?
Exactly. It could be anything. And the hard part is the science that we are doing as plastic surgeons, whether it's doing heavy metal examinations of taking tissue from women that want their implants removed. We send it to the laboratory. We send the implants to the laboratory. We check blood levels. We check specimen levels. And they're really not different than what they were for somebody who didn't have implants. But people are like, oh my God, I have all these issues. It's these heavy metals. It's this. And yes, it takes heavy metals in order to produce implants, to make them safe, to make them sterile, to make sure that the chemical properties of the silicone are stable.
So now do those symptoms go away after the explant?
Some people will sit here and say yes. And I've personally taken care of patients who, hey, I think I have issues with the implants. I want them out. I've tested everything. Great. We take them out. 6 months later, they're, hey, you know what? I took out my implants. I still have the same symptoms. They didn't get any worse. They didn't get any better. I want my implants back. And so now you paid money to put them in. You paid money to take them out. And now you're paying money to put them back in again. I try to keep an even keel. I'm neither for implants or against implants. I just want people to be happy. If you want them out, I'll help you. If you want them in, I will help you. But I try to be honest and upfront with patients in terms of expectation. I put it really simply. If you think you're going to have issues with implants, I say, please never, ever, ever get implants. Really simple. If you're like, hey, I think I want implants and I think they're going to be fine for me, even though I read about this, if you go in with a good mindset, I think you end up with a great result. If you go in with a bad mindset, you're going to have issues.
Now, is there different techniques with the explantation?
Well, if you're talking about explants and specifically the science, because we've, as plastic surgeons, have taken this very seriously, and there's studies at different locations all over the United States of studying the difference between somebody who's like, hey, I have implants, I take out the implants and that's it. There's people that will take out the implants, take out the scar tissue. And then there's the fancy word of where you're taking out the implants, you're taking out all of the scar tissue, and you're taking normal tissue out all in one piece called en bloc capsulectomy. That is a cancer term. I want you guys to understand. A true en bloc capsulectomy means I am removing the implant, I am removing the scar tissue, I am removing your breast tissue, I'm removing muscle, I am removing ribs. That is the true definition of an en bloc capsulectomy. That is only done for cancer operations because you worry that the cancer has spread beyond the borders of what it is. So you are taking everything normal around it. And when surgeons do this, and there's surgeons that charge a lot of money to do this, the incision that you get is like this long. It's literally from here all the way across.
Is it like a mastectomy?
It is a mastectomy because that's the access that you need in order to remove the whole implant in its entirety without touching the remaining tissue. There's surgeons that do it through a smaller incision, but as you're bringing it out, you're spilling tissue. So there's always going to be some quote unquote contamination, but you end up left with a huge scar, like you're a cancer patient.
So true explantation is not really an en bloc.
No.
Okay, so that we get the misconception of like, oh, I'm getting an en bloc.
Do you get do you get a bigger scar when you explant it, or is it the same exact scar?
It depends on what the patient wants. This is a conversation I have with my patients that want their implants out. I'm like, you want your implants? You want all the scar tissue? Do you want me to risk damaging your nerves because your scar tissue is literally stuck to your axilla where there's all the nerves that allow you to move your arms? And we can sit here and kind of chase that or create another scar in your armpit in order to remove it more safely, but it's not worth it. We've, like I said, as plastic surgeons, we've taken this very seriously. We've done studies and show legitimately there is no difference between the patient who gets the implant taken out and the patient who gets the implant plus all of the scar tissue or the capsule out. No difference at all. But people read these blogs or go to these posts or whatever and says, oh my God, you have to go see this doctor and do an en bloc capsulectomy. The science shows there is no difference in terms of some people get improvements. They get improvements whether it's just the implant or it's the implant and the scar tissue. But why would you want to traumatize your entire body and destroy and disfigure it unless you really knew for sure that it was going to fix a problem?
Yeah. And also, like, aesthetically, when you get an explant or when you take out the implant, you're like, it's like a sack now, right? Because you've stretched it and everything. So does that get fixed? Like,
Well,
do you do like a lift as well every time, or is it like, how does that work?
You're talking about elective surgery.
So no.
It's what you pay for. If you go to a restaurant, you're like, oh my God, well, do I get the truffle butter? Do I get the fries? Do I get the salad?
But I mean, I would think just even looking at something that was full once and now is like
saggy.
droopy, just more like little raisins. I think it might be, that might make me sick just looking at that.
Oh my God, the little
More than-
raisins.
I mean,
Some people like little raisins.
I mean, it's true. I mean, you're
mean,
not
just-
talking about eating the raisins, guys, but like I said, when it comes to everything we do, you understand it is elective. There is no medical necessity to removing the implants. Science hasn't come, and maybe in the future it will, says that implants cause XYZ. It took them God knows how long to sit here and say smoking leads to cancer. They could say it could lead to it, but they couldn't prove it. And once they proved it, that's when the lawsuits came out, right?
now question, since we are talking about BII.
Systemic symptoms
Yeah,
of breast implants.
Yeah, is it more from saline or silicone implants, or is it both, or is it more? Because that's what I don't know.
When you talk about breast implant issues, there is no delineation between saline or silicone.
So it's
It
found
is
in
just
both.
the implant. You understand that there's situations where, hey, I have a prosthetic implant, like a hip or a knee or a shoulder, that have issues similar to this. So it's not just implants, like breast implants. Anything that's foreign in your body
your
can
body.
cause your body to have a reaction. Could it be systemic? Yes. Could it be local? Yes. And this is the thing about science. Everybody's body is uniquely different. Your ability to fight infections. If I had a cold and I spread it to you guys, maybe I don't have sick, but you guys get really sick. Think of COVID. If everybody had COVID, did everybody have the same reaction? No. It's the same virus, but how it affects people varies. It's the same thing with implants. You both have implants. Could you sit here and say, hey, I'm tired, I'm fatigued, I'm all this to the implants? No, but I've known both of you, maybe not you before implants. I knew you before implants. You're still the same person. Your brain fog is still your brain fog.
I've always been brain fogged.
I think I've had it before the implants.
So I sit here and they happen to be related, right? You're sisters.
I was probably born with brain fog.
So from that standpoint, it's hard to sit here and to blame just that. But like I said, I'm not for implants. I'm not against implants. I'm just for people feeling better about themselves. Our mission is what? We inspire people to be their own kind of beautiful, whatever that means to them, right? It's not about implants. It's
Little boobies and big boobies.
correct. If you have big ones and you want them small, we can help. If you have small ones and you want them big, we can help.
So, what would you say is the most common concern after an explant?
It's always going to be the appearance. It's always going to be the appearance. And I tell patients, you end up with a better result if you're going to sit here and say, hey, I want the implants, the scar tissue removed, if you're going to have a lift. Because then I don't have to make a big, long scar under your breast. I just use the incisions that you have to do a lift to get the tissue out that you don't want. But again, that costs money. There's surgeons that are charging anywhere from $30,000 to $100,000 to do an end block capsulectomy.
Wow.
To
$100,000.
take everything out?
But remember, when I'm saying en bloc, I'm talking about the implant and scar tissue. I'm not talking about them removing muscles, them removing ribs, them removing skin. It's literally just removing the capsule, scar tissue, and the implant. And that's it. And $100,000.
And not making it look cute anymore.
Nope. That's just doing that. But hopefully for $100,000, you're like, hey, you're going to remove it and you're going to make it pretty. You hope so. But like I said, everybody's kind of different.
Yeah. Well, okay, so besides implants that are being reversed, what other trend have you guys noticed that are
The
being...
other shelf. The other side.
The other
BBL.
shelf.
How about the other...
The cherries and the peach.
But it's the rack. That's supposed to be a shelf, right?
Yes,
Yeah.
the shelf.
Shelf rack.
I call it more of speed bumps. The
You
speed
got
bumps on your
both,
body.
sister.
Speed bumps
Yeah.
in the front, speed bumps in the back, right?
Little,
The fun
little
spots.
hills.
You know, I think when we talk about, like, again, reversal of, like, your butt. And I think I've done one in, like, the last 7 years. And she's like, I love it. But now where I live, I get so much attention that it makes me uncomfortable. Because she's in a very conservative place. And she already had a nice peach. But she's like, hey, I just want it perkier, a little tweak. So we didn't add a ton. But when we do a BBL, or when I do a BBL, the goal is about what you remove, not what you put in. So we didn't put a lot, but a year and a half later, she's like, I need to make it smaller. She's like, I love it, but it's just, I get so many eyeballs of people staring at me in this smaller place in the upper Midwest that she's like, I just can't. Like, people are looking me at the store and like,
Dropping off the kids, probably
like
the dads.
checking out the booty.
Yeah.
And it stands out because again, it's a lot. And it's not that it's bad. It's just where she lives. It's a conservative
Yeah,
place.
she doesn't want that anymore. You
Move
just
to a
change your
different
mind.
place,
Yeah.
if you're like, love
So,
it.
so can you reverse a BBL? Absolutely. But it takes special methods that you sit here and you try to avoid scars because you can reduce anything by removing skin. But now you're talking about a scar that's not hideable. You wear a swimsuit and yes, it'll get camouflaged, but
Or the
once you're
laxity.
naked, you can't unsee it.
How
Oh,
about the
that's true
laxity?
because your skin's stretching. So, wait, what do you guys think? Because you know how Kim K's butt is different and Chloe's, like, it was a lot bigger than what it is now.
But they were also bigger themselves, I feel like.
No, yeah, like, obviously,
So
you know, they
lost
might
a
have
lot
done.
of weight, so
yeah.
everything just shrunk. Because they still have big butts.
They still do, but it's, like, significantly smaller. If you see a side by side, we'll put a picture up. But the side by side is crazy. Like,
Well,
it's,
they probably showed you the Kim K when she was like post pregnancy and her ass was literally like bigger than all three of us put together.
let me look it up.
And then now she maybe looks like Nurse Scottsdale.
Yeah, like
Where I
more-
would still say curvy, but not huge.
Bigger.
And so from that perspective, I think that was just more weight loss than it truly was lipoing and trying to skin tighten that butt, which you can do. But it's kind of a hard ask because you have to lipo from everywhere. You can't just be like, great, I just want to take it from the projection or I want to take it from my hip dips because your skin has to shrink evenly.
Yeah. Well, I don't know, because if you, like,
You're like,
Like-
oh my God, she had to have surgery.
no,
right?
because Chloe's, too, was massive, and then it got so tiny, but she lost a lot of weight, too, and she goes to the gym, so I'm sure her
Oh,
skin.
because it's the gym, right?
Wow.
Yeah, you go to the gym.
Allegedly. I go to the gym
Yeah,
here
and,
and there.
and allegedly you...
Here and there, I pass by.
Just like I go to the gym every day.
Yeah.
Oh, guys.
Okay.
I wish people were more honest. We talked about that in our last podcast that we wish
But
how.
I am. People ask me, like, I haven't been to the gym in, I don't know, at least 7 years.
That's
How-
not
Maybe
true.
longer.
How long have you had the
The what?
thing in your room?
The tonal?
Yeah. How long has that been
A
there?
couple years.
3 years. I paid for a membership of what, $75 a month. She's used it twice, guys. She's like, I want a tonal. I'm going to start working out.
Knowing that it's available. To
And
when you
and,
need
and I
it.
gave it to
It's
her
it's
for
been
her birthday,
available.
and it was not inexpensive. And she's like, "Oh, it's just like her
And you have
tonal
to buy
membership
it.
costs more than my membership to a year does. For 2 months is more than what I pay for an entire year of my gym membership that I actually use 90% of the time.
Where's your Peloton? I haven't seen that in a while too.
Oh, it's upstairs.
Oh,
Yeah, another
collecting
gift.
dust.
Another gift.
That hurts my butt.
You have
Yeah.
padding.
I'm like, it hurts my
Don't you
butt.
have padding on your butt?
I do, but it still hurts. It's not.
There's
like, I
bike.
know. Okay, I'm gonna start working out. Maybe by
Don't
our
believe her.
next podcast. I'm
Maybe.
gonna say I started working out.
You started.
That isn't. Okay, I'm just gonna keep my mouth shut.
Just don't say
That's it. I'm just gonna stop right there. I'm just gonna stop
Mm-hmm.
because neither of you actually work out.
I used to work out.
Sexercising doesn't count.
It's every bit of
You
exercise
know who you are, who
counts.
she sexercises
No.
with, right?
No, shut
You
up.
know who I'm
gonna
talking
cut
to.
that out. I'm
Okay.
gonna cut it out.
No, she won't cut it out.
I'm gonna
I'll
cut
make
it
sure
out.
of that.
I'll make
Would
sure
you
it's
like
cut
me
out.
to
Okay,
call
guys.
them out?
I'm gonna
Yeah.
choke
Yeah.
you. Anyway, moving
Well,
on.
I don't know what you're into, but please stop.
Janet, grab your man.
She's sick. I'm gonna
Grab
choke
your
you?
man.
I'm gonna choke you.
Yes.
What is
Guys,
that?
Okay, yeah.
Yeah,
What is
Janet,
that?
grab him, please.
She's like, I'm gonna choke you.
yeah,
seriously?
like to shut up.
Really?
Oh
Is
my
that what
God.
you do?
Anyway, guys,
I
so
quit
working
this
out.
podcast.
Look at that. That's it. They're literally speechless. They're literally speechless.
You have issues, dude.
I have
Back-
no issues.
You have
Back
issues.
to our subject of
is?
reversal of surgery. We're talking about surgery.
We talked about
BBLs.
BBLs. We
How
talked about
filler?
breast. Well, I would say when you talk about filler, that's kind of more your alley. But
But you've also done a lot of surgeries where you're literally taking
Like cutting
filler
out.
yes, I think back in 2020, we had a group of patients that went and had their lips done for $99, a syringe. You're like, oh my God, where do I go and sign up? Well, you went to their house. They used product that had contamination, meaning it had bacteria in it. So when it got injected into your lips, it's like taking mold and putting it inside your body. And so it didn't do well. It got infected. People went to the hospital. People got sick. People had pus coming out of their lips. And somehow or other, I took care of one patient. And next thing I know, I have an entire practice dedicated to taking care of infected lips. And even to this day, even though it's been 4+ years, I still take care of patients with bad lip injections. And so, yes, you can surgically remove certain things. And part of the art and science of plastic surgery is how do you hide the scars when somebody's fucked up? Excuse my French, but that's what it is. People have totally gotten screwed. And how do you sit here and fix something that's gone bad? Usually, if people have done their job and have researched the injector or the practice, you want to inject hyaluronic acid. That's where it falls into your field of expertise, right?
Yes, and we can reverse it. We can dissolve it, and no issues. But when you get injected with something you don't know, that's when you can have real problems because you can't reverse it.
What products would those be, do you think?
As far as that, you can't. Radius, I'd say things like Sculptra, Bellafill, also silicone. That used to be pretty long time ago. I mean, that
People
was
are still injecting silicone to
Yes.
this day.
Injecting it where?
Anywhere?
Yeah, different parts of your body.
So it's called Silicon 1000 or 100. I always forget.
People bring it from other countries. And
Actually, you can get it in the US. It's
Really?
FDA approved.
literally,
But here's the catch, okay? This silicone is FDA approved to be injected into the eye. Okay?
For
and again,
what?
this is for ophthalmologic reasons or basically eyeball reasons, right? But since it's FDA approved, you can order it and use it, quote unquote, off label. That means you can inject it almost anywhere else. So people are injecting silicone into their penis.
Butt injections.
They're doing butt injections with it. And like I said, it's silicone. It's like an implant. What does an implant do? It creates scar tissue, a capsule around it. But this is liquid, okay? So the silicone can migrate even though it's encapsulated. But if you get an infection, it's hard to get rid of.
Does
'Cause
it
it's
go into the
migrated.
bloodstream?
It can, if not injected properly. But this is what people will do to be like, hey, great, let me fix your hip dips permanently. It only costs like $3,000 or $5,000. It's way less than Sculptra. Sculptra is another filler, L-polylactic acid. So it's an acid. Your body will basically dissolve it eventually. But because it stays there a long time, if it gets infections, it has its issues. When you talk about Radius, it's calcium hydroxyapatite, which is basically a calcium based, and because it's calcium, your body will eventually dissolve it, but it doesn't do it right away. The only one that's truly easily reversible is hyaluronic acid. Your body has hyaluronic acid. It already has hyaluronidase built into your body. But if you have it and you don't like it, you just go inject it, and it's like whiteout. It removes it. But there's new hyaluronic acids out there. I won't mention companies because I don't want to get canceled here. But they process the hyaluronic acid in such a way that it's harder to get rid of. So sometimes even though you put the white out, you can't white it out because it's got these special properties that don't allow it for the body to dissolve it as fast.
It's not as easy to.
It's
to
still
dissolve.
dissolvable, but it makes it harder, guys. So again, these are all the little nuances that we're only seeing today for issues that happened or injections that happened 5, 6, 8, 10 years ago where people are like, hey, I had filler, it should be gone by now, but some of it is still there. Like some of these products I actually like for the penis when I do my magic shot or male enhancements because I don't want the product to go away. I want that to be a really long
stay.
time, right? So
Yeah. Well, I was gonna say, isn't that like one of the selling points is that it stays for a really long time,
that
and it's
should
hard
be.
to get rid of.
Yeah,
Yes.
but some people, like for you metabolize products really quickly.
Yeah, like even those fancy products are supposed to last a long time. It lasts 6 to 8 weeks. So I have to use products that are supposed to last 5 years. But understand, when we're talking about something like Belafil, which is the only FDA approved product that's for 5 years, once you inject it, you can never get rid of it. It is permanent. The reason it's 5-year indication with the FDA is because the body builds collagen, i.e. scar tissue around this product. And as that collagen is there, it adds volume. As your body tries to dissolve it back and forth, eventually it shrinks. But the product itself will be there forever.
Oh, that's crazy.
Right? So,
So Belafil is a type of filler.
Yeah.
Okay. Huh. Maybe I need that for my nose.
I mean, you can, but if you don't like it and it doesn't settle in the right place,
Oh, then you're fucked.
it's there forever. Unless you're doing a surgery trying to surgically remove it, i.e. lip fillers. That's usually what I end up removing is people using silicone or people putting in Belafil, but the non-FDA approved version that you can get from China for a lot less. So there's your hot tip. If you want cheap
hot
product,
tip.
you can get it from China. But again, understand that if it's what you're injecting is dirty or contaminated, you literally have just injected yourself with something that's going to make you very sick.
And it's going to cost you a lot more money.
Yeah, I just saw a TikTok too of speaking
TikTok?
of TikTok. Now
It's
that
back?
it's gone, or now that it's back, thank God. No, of like, you know how with nose fillers, like there's a potential that you could go blind.
Absolutely. It's not a potential. It's always been there.
Well-
That's why you don't choose to do it, right, Jay?
I don't. I'd rather not.
So who do
Very
you send them
slim
To
chances.
you.
to? Me.
So whenever you want to.
Yep. But the difference, I'm going to interject real fast. It's good to do nose filler if you know what you're doing. I've done enough rhinoplasties to know the anatomy of where the blood vessels are or not. That doesn't mean that the risk is 0. But as long as I stay this narrow road, I should be okay. Doesn't mean that there's not a blood vessel, but you just need to be conscientious about it. Yes.
Oh, yeah. So I was kind of veering off topic a little bit, but about the nose filler that happened to this girl, but she was lucky enough to like, I don't know, like massage it, so like kind of reverse it. Like she was starting to feel like one eye starting to go blind, but she Googled something like massaging it, and it like was starting to reverse the effects a little bit, and she regained a little bit of eyesight back.
It was probably maybe the numbing or something that she felt, but it's not going to reverse it by massaging.
Or like I don't even know what it was like, but she caught it in time supposedly, so you can't reverse that then. Like once you
I
start.
love TikTok, but sometimes TikTok is so full of shit.
Well,
okay?
that's why you're myth busting right now.
I
'Cause
know,
don't
and again, I don't like to call people out, but I think dynamically, the thing when you're talking about filler and going blind and having issues is simple. The reason you start to go blind is because you inject filler into an artery and you push it so hard that it goes retrograde. So it's literally going backwards of the way it's supposed to go into your eyeball. Your eyeball only has one artery. That's it, one.
That's
It's
scary.
like you have one highway. If I block it, well, guess what? Nobody's going that way. End of story. It's a one-way bridge. One way. You block it, you lose your vision forever. You have maybe a couple of hours to basically unblock it, meaning you have to go and put hyaluronidase. I know a friend of mine that this happened to, that he hired this very experienced injector, and literally on her second day she injected somebody and that person went blind.
Oh, that's so scary.
Second day on the job, and she had been an injector for 20 years. He's a plastic surgeon, well established. She started working for him. She did an injectable, and the patient literally went blind.
That's so scary.
So, but he was well trained that even as it was happening, he did a cut down, meaning he literally found where the artery was, made an incision on her face, found the artery, injected the hyaluronidase, and all of a sudden she's like, hey, I can see. And then like after 30 seconds, she's like, hey, I can't see anymore. So even though he kept injecting it, it was just so much stuff that went the wrong place that she went
Dang.
blind. Even though he got her back, he physically got her vision back after she went literally like dark,
God,
like
that's
me
scary.
covering
It's
your eye,
giving
and
me
you're
chills,
like, hey, great, that's it. It's gone
Eyelashes.
on that one
I
eye,
don't want to.
and he was able to get it back, and
Okay, I
she
don't
still
need
ended
nose
up
filler anymore.
going blind.
That's why I don't take my chances.
But I don't want
I
a
don't
nose
do
job.
rhinoplasties. I don't do that. I'd rather you do them. I just
That's so scary.
And I sit here and I tell you, the things that we do in surgery carry risk. It's whether you're like, gosh, well, why is the nose filler so much more expensive than like lips? I mean, theoretically, you could go, Brian, from lip injections if the product is injected in such a way and your blood flow anatomy varies. So it's not without risk. But that's why it costs more, because we have to be more educated, more prepared to deal with those circumstances and be like a hawk and realize as they're happening. People usually get what's called necrosis. That's where you inject something, it goes into an artery, and that artery feeds a bunch of your skin. Once you stop it, all of a sudden the skin starts to turn black. It turns purple because the skin is literally dying.
That's scary too.
That could happen with anything. That happens in surgery. If we do a tummy tuck and for whatever reason you stop the blood flow, if I were to hold your wrist, both your wrists really tight, and all of a sudden just squeeze, and no blood flow, your hand would die.
hand would die.
Your hand would literally die. And that's all it would take, which is scary, but that's the world we live in.
That's scary.
But like I said, everything carries risk. A rhinoplasty, nose filler. And this is where we go to the whole reversal aspect. It's being prepared for the issues and understanding it is not about being prepared for the issues. It's about anticipating where the issues could happen and how to prevent them. Not to deal with them, but to prevent them from happening.
yeah,
Wouldn't you agree?
yeah, how to fix them too.
Yeah, and how to reverse them. How long would you say you have? Like, let's say you're starting to, is it during the injecting process or is it when you're going home and then it?
You should see.
It's
something.
both. Like usually when you do an injection, and again, it's never personally happened to me. I've seen some patients who have had it after the fact, but the first thing you report is pain out of proportion to the exam. Like you're like, gosh, this just hurts so much.
Ooh. Okay.
And the reason it hurts so much is because the first thing that dies are nerves. They are the most sensitive to blood flow, which is good. God made it that way, right? Mm-hmm. If your nerves start to hurt, something's wrong. It's just
It's
that
like your
simple.
little alert system.
Especially if you've been numbed and all of a sudden you're like, gosh, this is really hurting. That should tell you something in your head right now. As an injector, as a provider, you should know something is going wrong, in the wrong way. And that's where you got to stop and think about it
But the
really,
bruise
really fast.
just kind of keeps on, like, there's a bruise somewhere and it keeps growing and it keeps like, it's just like, it just follows.
And it doesn't
follows.
happen overnight either. Like sometimes it takes like 2 or 3 days where you're like, hey, like it just looks weird. Oh, it's fine. It's fine. It's just a bruise. And it just grows. And then all of a sudden, once it's black, you're done. It's not coming back.
Product, yeah.
I've seen it happen to nipples
Oh,
from lifts. Yep. The nips, right?
not the nip. Okay. Well, have you had any patients or like heard of anyone, any friends or anything where they got the reversal that they wanted and then they regretted it and wanted it? I know you mentioned the one who got
Implants, right?
implants, explant, and then implant again, but does that happen often? Like, do they
What,
regret
surgery?
usually? Yeah, or anything, or even lip filler, like they get it dissolved and they're like, immediately, I want it back.
Well, I mean, most patients do revert. I mean, they want to dissolve because it's migrated to another area, but usually they want it back. Like as soon as you reverse it, they want it back. But I have them wait a few weeks before I add anything. But yeah, they don't want to be seen without the lip fillers. And that's the thing.
I say it kind of works the same thing when I do the magic shot. If you're talking about the penis, we augment it. And again, the hardest part about that is, yes, it gets hard, but it lives in a flaccid state. It's relaxed most of the time. Nobody walks around with a 24/7 Woody. Nobody does that, right?
Scary.
Because the longest that the penis can last in an erect state is about 4 hours. After that, literally the blood flow starts to die. And so, the blood flow stops and the penis starts to die.
You
Okay.
can kill your penis?
Yes, absolutely.
Well,
And
who
the
lasts 4 hours?
and the
That's crazy.
procedure for that is pretty freaking gruesome. I remember having to do it as a first year surgeon, and I was like, I felt so bad for the guy. And again, it wasn't because of anything. It's because he had cerebral palsy, and so sometimes they go into spasm and have certain issues that other people don't. And he had an erection for like 5 hours, so we had to emergently take him to surgery and basically cut into his penis. And again, he wasn't all there, and we had to leave tubes and drains to help it drain, and it was just, I just felt so bad for him. And like I said, the guy was well endowed. Like, I'm talking, he was like this and like this,
Well-
and he had never had sex because he was born that way. But if you saw it, you'd be like, holy moly. Like, you'd be like, hook me up, brother.
Damn.
And
Well,
I
don't
ca-
they do penis transplants?
They do. That is an actual procedure. But
I
like I
learned that on
said,
Grey's Anatomy.
yeah, because everything on Grey's is totally real, guys, by the way. McSteamy, McDreamy.
McDreamy and McSteamy.
But like I said, it affects guys. And as you're putting product anywhere, it can migrate, it can shift. And again, if you're thinking about the penis and it's literally living in a hang state, where's all the product going to want to go? Towards the head. It's going to migrate down. So sometimes we have to remove some of it. And then they're like, hey, how soon can I get some more put back in? Because they're used to
Being
the
thicker.
meat.
Thickums.
So
An
yes.
Italian sausage.
How?
I don't know.
So now you like Italian?
I've always
don't like
liked
shrimp?
Italian. I don't like shrimp, guys.
You don't like shrimp? Okay.
Oh
She doesn't like shrimp, huh?
I like
Okay.
shrimp sometimes.
Or so
not-
she says.
Okay, there
but
she says she
I
only
like-
likes shrimp
I like
sometimes.
jumbo shrimp,
Okay.
not the little minis.
Okay. There you go, guys. She doesn't like shrimp. All right. So, have you seen anybody or do you know anybody who's had a reversal, Alondra? How about you, Jay? In anything besides lips, of course, because that's your field of expertise.
I guess just the clients that come in that have
Implants and they take 'em out?
Explanted, yeah.
And how do they feel?
I mean, some they just wanted them out just because they wanted to go smaller, and some people are okay with it. I'm just waiting for them to come back and like, oh, I want them back again. But I don't know, some do okay.
Well, didn't we have a coworker before who got her implants out too? Or no?
Yeah, and I think, part of the reason is something that we see in plastic surgery called breast implant fatigue. It just basically means you're just tired of big breast or bigger breast. And like I said, It's no different than I have a red car. Hey, you know what? I'm tired of this red car. I want something different. There's nothing wrong with the red car. It just means I want something different.
Yeah, till you get bored and like, hey, you know what?
Yeah,
Are,
little
are you
boobies.
ready to get your girls out? Are you ready to
No,
get your girls
I'm
out?
Well,
perfectly
yeah, I
okay.
saw the cutest little boobies today that I want. They're like,
Cutest little boobies.
they were so cute. And she got like 200, what was it, 220s?
We did
They were so
220
cute.
cc's. But again, she was super petite. Her chest
she
was
was
really
tiny.
small. Her BMI was 20. She probably weighed like 105
She
pounds.
was like a little Kendall Jenner, like just tiny.
Correct. And so part of that is for everybody. But I think the biggest thing that I want people to understand when we're talking about the reversal of decisions, not plastic surgery, but remember, plastic surgery are decisions you make. Nobody puts a gun to your head and says, hey, do this. Oh, my surgeon made me do this. No surgeon, because remember, you paid them. So there's no way they're going to put a gun to your head. You're going to pay them and you're going to do something, right?
Yeah.
They give you the information, you agree or don't agree. And if you don't agree, you don't have surgery. So when I hear like, oh, my surgeon made me do, you signed, you agreed, you said, I'm okay with what you are recommending. You could always say no, because again, remember, as doctors, plastic surgeons, we give recommendations. We don't give ultimatums. I can sit here and say, I will do your surgery this way or I won't, but it's your choice. And if you agree with what I'm saying, then you're agreeing to having that procedure. And at that point later in life, think about it. Would you make the same decision at 18 that you would at 40? Probably not.
Well, it's different stages in life too.
Correct. So there's always going to be evolution, especially you, right? You're like, I want smaller boobs. Why didn't you get smaller boobs to begin with?
Because you made me get bigger ones.
Made you, right? Right, made you.
I had no choice. Anyway.
But why? Why do you want smaller ones compared to the ones you have?
No, I just think they're so cute. Like, they match more outfits. You know, like, sometimes they're just too big. And then I don't have the shelf to even it out. So I'm like a walking AirPod sometimes. And it just, like, for my body, it's not.
But why did you end up getting bigger implants? It's okay.
Yeah. Oh, hi. He's in the He's in the shot.
It's okay. Jaden, go back to watching TV, okay? We're almost done, baby. Okay, all right. We'll be there in a second, okay? Okay,
baby,
good.
We're gonna be right there. Okay, close the
5
door,
minutes.
baby.
Close the door.
Go get pajamas.
Okay.
But what would you say? Small boobs, would it fit your frame?
So why did you get bigger implants than what you wanted?
Because that was what was recommended to me, and
Based
I
on what?
trusted you. Based on my body and my big ass chest, that's what I needed. So.
Okay. So again, understand the dynamics. This person to my left here, Miss Alondra, oh, I want small boobs. And again, when you were healed, you're like, oh my gosh, my breasts are what?
Massive.
And what else did you say?
Oh, when I was fully healed, they're pretty.
Say that one more time so everybody hears that.
They're cute. They're pretty.
Okay. And hindsight's always 20/20. So if we reduced your breast size by half, how do you think they would look?
Still like saggy and not cute.
Okay. This is an honest explanation here as to why I had a conversation with her sister present, as to, no disrespect, your boobs are hard to work with. Unless we do X, Y, Z, they're not going to look good. I'll give you whatever you want, but understand that if what you're asking for doesn't look good, that is a decision that who is making?
Me.
You. And this is where I sit here and tell you, trust your doctor. If you're trusting them with your money, trust their opinion. That doesn't mean you have to go with that doctor, but if you're paying them money to do a surgery, trust what they're telling you.
Yes, and I'm very glad I went bigger because they look good. So.
But yet she still says she wants smaller ones.
No, because they're so cute.
Correct.
Yeah, but it doesn't, because, I mean, when you met me, I think I was pretty bigger, and then I went smaller, and then I went back to a little bit bigger. So it was like, I don't know. I thought I wanted smaller, and then when I was smaller,
You got the boob greed.
I was fine, but then certain things, I missed my bigger boobs. I don't think I went as big as the first time.
I think
but-
we have the same size, no?
But
now?
I'm happy where I'm at.
Yeah, but they look different, obviously, on us. But what was I going to say? Would you guys consider that a reversal technically? Like getting a surgery and then going back and changing it? Like, would you consider that a reversal?
She wanted to downsize. We did.
Yeah,
Right?
I think to a second. Yeah, I think so.
And then
Because
she's
you're
like,
reversing on,
hey, I
It's
want
nice.
the
in a
bigger.
way.
Yeah.
Yeah, I think so. Guys, what's our word of the day? Let's throw it in there.
What's our word of the day? What's our word of the day? Easy.
Easy.
That's our word of the day. Our word of the day is easy. Because
Why
plastic
easy?
surgery reversal is not easy. It's going to cost more money than probably your first surgery. You're going to have more scars, but you're doing it for your peace of mind, which is never easy, and it always costs more than anything else. But it is truly priceless when you feel you've gotten exactly what you wanted.
Yes, indeed.
So that's our word of the day. So what are they winning for a word of the day? You will actually win either a free t-shirt, a free consultation with me, or a free consultation with Nurse Scottsdale. Again, if you comment easy, either snap us, tweet us,
DM
TikTok us,
easy
DM.
on Snip and Sip. That's the
And
easiest
again,
way.
yes, you can DM us at Snip and Sip Podcast, right, guys? And so what are we going to talk about next week?
Next week, we were talking about sister. Tell us.
We're talking...
About who's a good or bad candidate for surgery.
Yes.
Yes, the good, the bad, and the ugly of having plastic surgery, meaning who is a good candidate. Okay, so stay tuned. It'll be totally worth your while. All right, so thanks again for joining us on episode number 14. Out. I hope you had as much fun listening as we did recording. Don't forget to follow us on Spotify, Apple Podcasts, and all podcast sites for new episodes, as well as Instagram, TikTok, and YouTube. Stay snatched, stay hydrated, and until next time, cheers.